Hello, my name is Rune. I'm a doctor in training in rheumatology, and if you're using methotrexate or if you're going to start using methotrexate, then you probably know that nausea can be a concern for some people that take it. Today I'm going to talk about 7 tips and tricks that you can try to use to decrease this side effect. I'm not going to talk about alternative drugs that you can use instead of methotrexate today, as it's going to make the video too long. And of course I would advise that you consult with your treating physician before you use any of these tips and tricks. So as a little bit of an introduction, you can skip this part if you know a lot about methotrexate already, but it's a drug that's used to treat arthritis like rheumatoid arthritis and psoriatic arthritis, primarily given in tablet form in doses up to 25 milligrams per week, and it's also used in the treatment of leukemia and lymphoma, but then in much higher doses up to 1000 milligram at a time. So the reason that the same drug is used both for arthritis and leukemia and lymphoma is that it inhibits or kills white blood cells. So in leukemia and lymphoma, the white blood cells have become cancerous, and then you use very high doses to try to kill these cells. In arthritis, the white blood cells are the drivers of the inflammation that's causing the arthritis, and then you use the drug in much smaller doses to try not to kill the cells but to dampen their effect, to slow them down a little bit. So the way that methotrexate works is that it blocks folic acid in the body. Folic acid is a vitamin that you usually get through fruit and vegetables in your diet, and it's used by the body when it wants to divide the cells. So the cells that divide quickest, like cancer cells, they will have the biggest effect, but white blood cells divide quite quickly even when they're not cancerous, so they will also have a larger effect than a lot of the other cells in the body when you use methotrexate. Many of my patients are concerned that taking a chemotherapeutic drug for a long time, which they usually have to do when we are treating arthritis, that it will cause some long-term harm. I think it's an important point that people with rheumatoid arthritis have a decreased lifespan of maybe 5 up to 10 years without treatment. After methotrexate was introduced as a treatment, the lifespan of patients with rheumatoid arthritis has increased and is now on the same level as the rest of the population. So I think that's a strong indicator that taking methotrexate, if you have arthritis, is going to increase the health of most people rather than decrease it. But of course, if you get nausea from methotrexate, it can be quite annoying or even debilitating. So here are 7 ways to try to decrease this side effect. 1. Be patient. I know this is kind of frustrating, but for most people the nausea will get better over time. So for some people it will be after just a couple of doses. For others it can take weeks or maybe even months before it gets better. So if you're having nausea and you have just started taking methotrexate, if it's somewhat bearable, I would recommend that you keep taking the drug and see if it doesn't get a little better after a while. Number 2, take the dose during the evening. The nausea that comes from methotrexate usually comes the same day or the day after you take the drug. If you take it during the evening, then you can sleep through most of the nausea and then feel a little bit better in the morning. If you have to go to work in the morning, it can be a good idea to take the dose on the Friday evening, and then you don't have to go into work feeling unwell. Number 3, increase the folic acid. folic acid should be used by everyone that takes methotrexate because it's very difficult to get enough of it through the diet when you're taking methotrexate. So 1 milligram of folic acid should be used every day. It can even be taken on the same day as methotrexate, and it's not going to decrease the effectiveness of methotrexate. A lot of the side effects of methotrexate will be reduced when taking folic acid, and it's even possible to reduce them a little bit more if you increase the dose up to 2 milligram daily or even 5 milligrams per day. Number 4, divide the dose. There is some data that dividing the dose to a morning and evening dose is going to give, first of all, a little bit bigger effect, that the drug is more effective against the arthritis, and also that the side effects can be reduced this way. So you usually then divide it into 2 equal doses, take 1 in the morning and 1 in the evening. It's very important, of course, that you don't divide the dose and take it over several days, because then it will start acting more like a chemotherapeutic drug and it will start to have an effect on your bone marrow. This can be very dangerous, so be careful. If you split the dose, do it on the same day. Number 5, using folinic acid or leucovorin. In my country, we usually use this as an antidote when there has been an overdose of methotrexate, but it can also be used to treat side effects. If you're going to use folinic acid, then it's very important that you don't take it on the same day as methotrexate. But it can be effective in decreasing the side effects if they are quite severe. Number 6, use antiemetics or try to reduce the stomach acid with proton pump inhibitors or H2 blockers. If you have an increase of stomach acid, this can cause nausea even without methotrexate, so it's worth trying either an H2 blocker or a proton pump inhibitor and see if that will help a little bit. It's also possible to use antiemetics like metoclopramide or ondansetron, but of course they have their own side effects, and ondansetron can be quite expensive, so we use that sparingly if there is no other alternative. And number 7, try switching to injectable methotrexate. This will bypass the stomach and intestines. When the tablets go through the stomach and intestines, a little bit of the drug will get into the cells that are lining the intestinal tract, and they will be exposed to quite a high dose of methotrexate, which can cause nausea. If you give methotrexate as an injectable, then you bypass this problem, and also the effectiveness of methotrexate is usually higher when it's given as an injectable. Where I work, we usually switch to an injectable after we have reached a dose of 20 milligrams per week. The problem with injectable methotrexate is that it's quite expensive, and in my country it's as expensive as the cheapest biological drug that we use. So it's usually reserved for when we can't manage the side effects in other ways. Okay, that's everything. I hope that some of these tricks will be helpful for you, and if none of them work, then I would probably discuss with my treating physician whether one should use another drug or maybe decrease the dose of methotrexate. So good luck, and hope you have a good day.